What are some of the risks or limitations that you've seen for a child going to vision therapy first before coming to you?
Well, first, I'm not surprised that they find their way to you because dyslexia was actually founded by an ophthalmologist.
I did not know that.
Yeah, in the late 1800s, and they described it as this word blindness. We now have more information that we know it's not a vision issue. Seeking out vision therapy can really prolong the challenges that students are having in the classroom. Students are starting to develop a really negative internal script. Yes. They're internalizing this sense of failure. They can't read this book. It's sitting in front of them. They're using their eyes. Actually isn't a vision problem at all. It's a language processing issue.
The question always is, should families then seek help from an educational therapist or from vision therapy? And we're going to break down the difference between the two and why you should be seeing one versus another. Welcome to In Focus, the podcast that brings vision, clarity, and expert eye health to your family. I'm your host, Dr. Rupa Wong, board-certified pediatric ophthalmologist. And today we're talking about a topic you might not consider in my realm, but it most certainly is. When a child struggles with reading or learning, they often end up at my doorstep to get their eyes checked, which is exactly where they should be. But the question always is, should families then seek help from an educational therapist or from vision therapy? And we're going to break down the difference between the two and why you should be seeing one versus another. We're diving deep into the world of educational therapy, what it is, and how it can really support children with learning differences and ADHD, dyslexia, as well as just executive function challenges. To help answer those questions, I am joined by my guest, Dr. Dominique Marinello. She's an educational therapist and founder of Reimagine Educational Therapy in Orange County, California, soon to be in San Diego. With a doctorate from Johns Hopkins and a very deep understanding of how kids learn, she helps families navigate this often confusing overlap between learning struggles and attention. So if you've ever wondered whether or not to consider educational therapy or how best to support your child when focus and frustration really gets in the way of learning, then this episode is for you. Thank you so much, Dominique, for joining us today.
Thank you for having me.
All right, so before we dive into specifics, can you just tell us a little bit about your background? Some people might not even know what an educational therapist does or who they help or what kind of kids you see.
Yeah, absolutely. So my background is in psychology and education. I have my master's in psychology and then my doctorate, as you mentioned, in education from Johns Hopkins. And that's really what educational therapy is. It's this blend of psychology, education, a little bit of neuroscience in there. And it's really all about helping students learn how to succeed in their school settings. And that can look really different depending on a student's needs. It typically is designed for students with learning differences, so things like dyslexia, ADHD, specific learning disabilities, processing challenges. And what we really try to do is hone in on those areas of strength that they already possess, build those up, and try to find those areas of weakness that we can really determine new strategies, new resources to overcome those challenges and be more successful in their settings.
If a parent is concerned about these diagnoses, and let's say they haven't actually gotten the diagnosis yet, what should they be looking out for? What are ways that it affects their day-to-day learning?
Great question. So many ways, but I think...
Yes, let's go break it down.
I think what we see a lot of times is resistance to schooling, creating smoke and mirrors, distractions, really anything.
My gosh, my daughter is so good at that. It's like, wait a second, is it my ADHD that now I've forgotten what you were supposed to do, which is math?
Yes,
okay.
The art of distraction is huge.
Yes, okay, yes. All right, art of distraction, check, next. Mm-hmm.
It can really look like disliking, dreading school. One of my students with a math learning difference used an acronym for math, MATH, mental abuse towards humans. And it was just dreading every day going into school, going to math. We tend to see some behavior challenges pop up in the classroom too, where students, the demands might exceed the capacities. And in order to cover for that, they're socializing with friends or playing the class clown.
Yes, that totally makes sense. My daughter will say, math makes my brain hurt. The other subjects don't make my brain hurt. But I'm going to have to tell her about the acronym math.
Yes.
She will probably wholeheartedly agree. She also then says IXL is like the worst thing for these kids as well. And that we could probably do a whole podcast about all those different types of learning strategies. But when you talk about all the different types, I mean, you're seeing kids with ADHD and dyslexia and math learning differences. It's such a lot of variation and a lot of variability. How is it that you can help? You just have to really focus in on a child, or there's some commonalities that can assist with all of them?
Honestly, every student is so unique. So I might use some similar strategies, but what that looks like for each student is going to be so different because their interests differ, their needs differ. I like to think performance in school like an iceberg, where at the very tip of the iceberg on top, what we see is their grades, their ability to do the work, do their math, their English, their history, also the social skills or the behavior that we can visually assess. But underneath that is all of these underlying skills, the processing skills, their executive functioning skills. Each of those individual variables creates that student that we see up top. So
I like that iceberg analogy.
Yeah.
That's really good, because then you can apply it. I mean, a lot of these learning differences, I would imagine, run in families. At least they do in our family, but they are very unique in my children. They don't have the same learning or processing issues. So that's such a great way to kind of think about it in general. As a parent of two kids that have learning differences, it can feel really overwhelming, right? And it can feel also very vague, like learning differences, and we're shying away from the word disability, right? We don't use that anymore. What are the most common challenges you see in your practice, whether, in that discussion?
Yeah. I would say the executive functioning piece is huge, because this is one that we don't explicitly teach in schools.
Right.
And yet it's kind of just implied that students will pick it up. And oftentimes when we do have students with learning differences, particularly an ADHD profile, these skills are just not so intuitive. The planning, prioritizing, organizing comes with a lot of challenges for these students. And so that's probably one that I see most often. And it's also one that has the greatest gains when we can build up skills in these areas, because executive functioning will persist for the rest of your life, not just in school settings.
And I found, this is what I think makes it difficult. So I don't know how you approach this clinically, but what works for me in terms of my executive function, all right, I like to use this kind of planner or this online resource. Doesn't work for one of my children. He wants to do something else. Whereas my daughter, like, sometimes her executive function is like so good that it can mask some of the other things. And so how do you, there's just so many different ways for planning. Is it just try it out, see what works, or?
There's a little trial and error involved for sure. And what you mentioned is something that I hear so often from parents when they find me, because they think, well, I've tried exactly what works for me. Why isn't it working for my child?
No, I kept trying to sit down with my oldest son, who has inattentive ADHD. I'm like, okay, so we got to create routines, and we've got to create habits, and you need a morning routine, and you need because he would never check emails, literally never check emails, and miss all these really important things, and he would forget to turn in his homework. All right, so now every day you've got to do this, and you've got to have your checklist, and he just never did it. Absolutely never did it. So that's something common that you
hear. Yes, and it really comes down to finding what's going to feel intuitive for this specific child, for this student, and then having a lot of consistency and support and putting it into practice, because sometimes they can be really excited by an idea at the start, and then that excitement tends to fade as they realize, oh, we actually have to do it every day. I'm feeling tired today. I don't want to do my homework today. But that consistency, that encouragement, and then when they start to see the gains in the school setting, that's really what sets our momentum going.
And then so you get that positive
reinforcement. Absolutely.
And that feedback loop, which hopefully then is sustainable, self-sustaining, right? Okay, now for parents who don't necessarily know, and I think this is probably a lot of misconceptions and myths, how is educational therapy different than academic coaching or tutoring, right? Getting a tutor for the dyslexia. How is what you do different?
Great question, and a very common one that I get from parents. I would say that academic coaching or tutoring on the one hand is really focused on the content, the now, the how do I best prepare for this test in this subject. And that is absolutely lovely to get students through this course or this year. But what educational therapy focuses on is the skills, those underlying skills, the things underneath the iceberg, and really honing those skills in those areas so that they're able to process and stay organized, stay prepared for their classes. It's building up these skills so that they ultimately won't need a coach or a partner or a tutor in the future because they have the inherent tools and resources to be successful in these school settings.
It sounds like a pipe dream for my oldest. I love him. He's so smart. But it can feel like that's just a mountain that you might not even be able to see over it. When you're helping these kids and you're really like just chipping away and getting to this place where they can be self-sustaining, I mean, especially for kids with ADHD or those kind of issues, there's obviously got to be a maturity aspect to it, right? They're a little bit delayed socially, emotionally.
Right.
Is this something that usually I wouldn't imagine all of a sudden your executive function is going to get better at 25. If it's not good now and you don't have the foundation, it's not going to be good. But how does age or developmental milestones kind of play into everything?
It's huge. Because sometimes I will see the greatest gains, and I love to, say that it's all of the hard work that I'm doing behind the scenes, but sometimes it really is that kids have reached this huge growth period in maturity, and oftentimes really taken initiative for themselves, because so often, especially when you have a child with learning differences, parents are playing a huge role in helping them cross the finish line every single year, and they are really providing so much support from behind that sometimes students can kind of take for granted or lose sight of the fact that they're in the driver's seat, that we're providing this support, but it's really them and their buy-in to the process that moves the needle. So sometimes when I see that piece click, and that does come with age or with maturity, where students are like, I am really in control of the effort that I'm putting in right now, and that effort's going to have huge rewards later. When I see that click in, that's when I see the biggest gains, and ultimately, as you mentioned, kind of that self-sustaining piece where students can keep going despite the challenges that they're going to continue to face if they have a neurodivergent profile.
With these neurodivergent kids, and you kind of touched on this, the school systems really don't teach a lot of this executive function, right? They don't scaffold it in the way that, at least I've seen it as a parent, not so much as a physician, but as a parent, they don't scaffold in the way it's all of a sudden, oh, well, now you've got 10 assignments and these very difficult classes, and you've got lots of things that you need to keep track of. And maybe they've done one class of, okay, let's write in your planner. They give a physical planner, but that doesn't work for everyone. It's often missing. And why is this? How can we better that?
Great question, because teachers and school systems are so, it seems like, burdened as it is.
Yes, no, 100%.
Yeah.
100%.
And it seems like the way that the system is set up right now, asking them to do even more is unlikely.
Right.
So I think that what I'd love for parents, for families to recognize is that they can play such vital roles as partners to the schools when they are recognizing that my child isn't getting exactly what they need in this school setting. Maybe the next question is like, well, what can I do to support that or to supplement that? How can I collaborate with the teacher to see what we could be doing at home to better support them in the classroom? If the teacher can't individualize in the moment during each class, which makes sense because they have 30 plus students each,
right.
What can I send them with to better prepare my child, my student, to be available for learning in the classroom? Because as much as I've tried, it feels like a really uphill battle to change the school settings from within. But I want to be as gracious as I can be to educators who are working so hard, but also recognize the students need a lot more than that. They need more. And Todd Rose actually wrote this book, The End of Average, and he opened, it's really great. He opened with this anecdote about how in the 40s, our fighter jet pilots were dying really by the droves. At one point there was 17 pilots that died in one single day. And they were really kind of scratching their heads like, okay, these were exceptionally talented pilots.
Right.
It wasn't human error. They looked at the mechanics. It wasn't the jets themselves that were creating these issues. And so they started to look at the cockpit and the cockpit design. And they were like, well, how were these designed? And they took measurements of over 4,000 pilots and computed averages on 10 different dimensions. And then they looked at their actual fighter jet pilot lineup, and they compared them to these average sizes. And they found that 0 out of those 4,000 plus individuals fit the average mold. And I think that this is such a great analogy for what our school system is like, that when we design something for the average, we might actually be designing it for no student at all.
Oh, gosh, yes.
So what we really need to do is think like, how can we individualize? I mean, back to that fighter jet analogy, they started putting in things like adjustable seats. You can move it forward or backwards, adjustable mirrors, things that they could actually individualize the cockpit to be more conducive to the size, the dimensions of the pilot. So that's what we have to ask ourselves when it comes to students, is how can we individualize based on their needs, their preferences, what's going to move the needle for them.
What an amazing analogy. That's such a great analogy. You take the average, you're not necessarily serving anybody.
Right.
All right. Now, when I often, of course, as an ophthalmologist, I will often be the first stop when a child gets diagnosed with a learning difference. And that's something I would recommend. We need to make sure that they don't just need glasses, or that they're not farsighted or nearsighted or astigmatism. Obviously, those can play into things. But then when I tell them, oh, no, your child's perfect 20/20 vision, there's no misalignment, there's no convergence insufficiency, that, the muscles are all working the way that they should, the parents still have sometimes a difficult time accepting that it's not a vision issue. And I try to explain that it's a processing issue. Everything the signals are being given perfectly well from the eye to the brain, but what the brain is doing with that information is the issue. Now, because they still assume it's a vision issue, then I think many parents will go and search up and will find vision therapy versus going to you as an educational therapist. So what are some of the risks or limitations that you've seen for a child going to vision therapy first before coming to you?
Well, first, I'm not surprised that they find their way to you, because dyslexia was actually founded by an ophthalmologist.
I did not know that.
Yeah, in the late 1800s. And they described it as this word blindness, because they were people who were otherwise incredibly intelligent.
Right.
And they just struggled in this one area in reading. So it was believed to be something vision related.
I did not know that. I'm going to have to look up that. That's so fascinating.
Yes. But I guess to your point, the fact that we now have more information, that we know it's not a vision issue, seeking out vision therapy can really prolong the challenges that students are having in the classroom. And what I tend to see is that when we aren't intervening early enough, students are starting to develop a really negative internal script. They're internalizing this sense of failure, the challenge in reading. They're creating more of these distractions, more problematic externalizing behavior in the classroom. Sometimes it can carry over into aggressive behavior at home, because they're just so frustrated with why they can't do what their peers are doing, or parents have really high expectations of them because they're so bright, they're so capable, and yet why are you receiving these low grades?
Right.
So I think that sometimes when we don't have the best fit in terms of therapy or support, what we're doing is we're not providing the right support when it's needed for our students. That's the biggest risk.
What do you wish parents or teachers knew about the difference between a vision problem and a learning issue?
I think it comes down to that iceberg analogy once again, that there's so much that we can't see underneath the surface, and what presents as a vision problem, because we're saying, oh, they can't read this book, it's sitting in front of them, they're using their eyes, actually isn't a vision problem at all. It's a language processing issue. And to address that, we actually need to address how they're hearing the sounds that our letters make, that phonemes, these individual units of sound that we put together as words and then words into sentences. That's where that issue comes in for a learning difference like dyslexia. And so I would love for parents to know that educational therapy exists as an option to really hone in on the individual challenges that their students are facing. And offer solutions to really help them in those school settings.
I mean, because there's really a lot of confusion online if you search online, especially about, I think, dyslexia, more so than any other of the learning differences, that vision therapy or eye exercises will help with these saccadic or smooth pursuit movements. And the research, at least from the ophthalmology side, doesn't necessarily support that, because we find the different types of eye movements that they're trying to track aren't necessarily the ones that are involved in reading. What does your research say? I mean, you have
dyslexia. The number of studies that exist on dyslexia actually probably matches the number of ways that people define it. It is one of the most vague constructs that we have in educational literature, as funny as it is, because as you mentioned, it's so prevalent. It's such a big issue for our families, for our children, and yet there's not a whole lot of consensus around what dyslexia is.
There's no specific.
No. And so we have what we've developed as best practices and things that we've seen to really work for our students and have been replicated in studies. And yet I just want to point out that I wish there was one single road path. I think if there was, parents would already know about it and we wouldn't be answering this question right now.
Right.
But to your point, yes, I think that often there's a lot of myths around dyslexia, and that, letters just present as backwards, or, if students can read maybe right to left rather than left to right. But that all comes down to that idea of it being a vision problem. Right. And I think that if we really understood that it was more about the Lego pieces of reading, the fact that we can piece these sounds together and they become words, and those words have meaning to our students. That's really the heart of the challenge that dyslexic students face. And so addressing that, allowing them to really master and understand those Legos that underlie our speech, our language, the text that they're going to see everywhere in the world and throughout their life, that's going to really make the greatest gains for them.
And I love that, because it's a holistic picture. And I think people are now a lot more on board with, just in general, holistic treatments for themselves and for their children, so that, it's not just the one issue. And of course, there are vision issues, especially with ADHD. We have seen convergence insufficiency when your eyes cannot focus up close. That's an actual eye ophthalmology issue that you can do eye exercises for. So I'm not saying that you absolutely can't do vision therapy. And I think for some people, they benefit when have you seen this with the contrast, if they flip it for dyslexia? Have you seen that?
Yes.
The contrast, and they seem to see better with it, but I don't see a ton of studies on that. But if it's not going to hurt, go
absolutely.
for it. But I always think that, for me personally, it's in conjunction with educational therapy, not instead of.
Yes. I think that parents who are dealing with any kind of challenge from their children, what would really behoove them to know is that there's no one solution that's ever going to exist for them. And it might be a combination of solutions that ends up working at the end. It doesn't have to be sequential, like try this, then try that. It might be these two things coupled together would work best for their child at this stage of life.
At what point should a child with a learning difference diagnosis see an educational therapist?
As early as possible,
if
I have my preference, because of what I mentioned earlier about that negative internal script. I think that the sooner that we can really intervene on some of these areas of need, the more momentum we tend to see, and the less the students are affected socially or in terms of their self-image as a learner who might be less capable. They actually tend to see that when they put in the effort, when they have the support and they have these new resources on board, they're just as capable as their peers. And we tend to see just a lot more motivation to succeed, because it can be really challenging to intervene when students already feel really badly about themselves.
Yes.
Emotion and cognition are so linked. So when we can keep students feeling positive, feeling curious, foster that love of learning, that's when we have the best results.
I would just have never, again, thought about it as being, I think I really just did equate the two in my head with with tutoring versus or academic coaching and but we looked then once we realized, there is this subject matter of educational therapists. You guys are hard to find.
Yes.
Especially coming from a small island like Hawaii, it's really difficult to find an educational therapist. Is there a association or an academy if a parent is like, all right, my child has ADHD or my child is struggling, she has visual spatial. And I thought that was so interesting when my kids had this psychoeducational testing.
Yes.
We did the full 3-day kind of testing so that we could really understand how they learn. It was so interesting to see that, this is why he doesn't listen to directions. His auditory learning is like 10%. You hear that? No wonder he can't follow that multi-step command. And I'm like, come on now. Yes. I said, take out the trash and then do this and then do that. But when we, for one of my children, when they realized, their visual spatial is very is an opportunity for growth, which I also really love the way that the psychologist wrote that. Not a weakness, but an opportunity for growth. And I was looking for educational therapists, and it was so difficult. Like, we still haven't found one in Hawaii to be able to support her. And I see that element of the fear of doing math. I'm not good at math like everyone else. And of course, that's never what you want for your child.
Yes.
So where can parents find these resources?
You're not alone in that search. Oftentimes from those psychoeducational analyses and assessments, that's really the only time that parents ever hear this term, educational therapist. Yes. It's the first time they've heard it. And we have a board, the Association of Educational Therapists. It's a national certification board, and there is a place on that website to find an educational therapist in your area. You can type in your zip code. Hopefully there is one in everyone's area.
I'll put that in the show notes, so I'll link to that so that parents can find it, because that's something, sometimes you're just Googling and you don't know, are you finding the people that are actually certified and trained in this particular area, or are these just people who, there are a lot of coaches that just call themselves educational coaching or
in any of these fields. Absolutely.
Yes. Okay. So you have the association and then what other things do you wish that a parent would know as they're approaching, let's say, a new diagnosis for their child?
That process can be really scary, hearing these new terms, these new diagnostic labels, and I really encourage all parents to look beyond the label and recognize your child as this amazing individual first and foremost. They are your most prized possession, and that is always going to be most important, is maintaining that relationship, that belief that your child is special and can be successful and is going to reach the greatest heights in the world. I think that that's most important, because this process can be scary and murky, and we never want to lower our expectations of children, of students. What we want to do is just find the right support to help elevate them to exactly where they're meant to be.
I love that. That's exactly it. That's all we want as a parent, right? To be able to support them so that they can achieve everything their heart desires.
Yes.
Thank you so much, Dominique, for joining me today. Where can people find you online and in person?
I'm at Reimagine Education, and you can find me at educationaltherapysd.com.
I appreciate you taking the time. I know that there are a lot of insights in this episode that are really going to help so many parents. So thank you so much.
Thank you.
Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong, or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.